Time, smoking, tea or coffee are just some of the few things that cause your teeth to yellow and discolour. Whitening makes the coloured material in the enamel go colourless by oxidisation, so that stains are gently removed, leaving teeth cleaner and brighter. Whiter teeth can take years off your appearance. The effects can last up to 4 years, depending on whether or not you smoke, drink tea, coffee or red wine. Regular top-ups can mean you'll never need to walk around with stained, discoloured teeth. Although the teeth themselves whiten well, any fillings or crowns will remain the same colour and may require replacing to match your new, whiter smile.
All whitening is based on a hydrogen peroxide solution. The only difference is whether you want your dentist to do the whitening in the surgery, which takes about an hour, or to provide you with custom-made trays for you to use at home for about 2 weeks. All Discus home dental products have ACP, amorphous calcium phosphate, potassium nitrate and fluoride to provide reduction in sensitivity and enhance whitening results. There are 2 ways of carrying out teeth whitening. The first option is the tray-based Night White ACP or Day White ACP. The gel is placed in a custom-made night guard which is worn for 1 hour to overnight, depending on the gel, for 7 to 14 days. The second option is surgery-based Zoom, otherwise known as light-activated or power bleaching. This uses a combination of a hydrogen peroxide gel and a specially designed lamp to accelerate the process. Usually, all that is needed is a 45-minute appointment. Your dentist will provide you with top-up trays. These trays will help you maintain your whiter smile. Patients should make their choice by thinking about whether they prefer to whiten their teeth or want their dentist to do it. The other factor is how quick you want the results and if you suffer from sensitive teeth. After your initial consultation, your dentist will advise you on which combination will work best for you. The dentist will take a photograph of your smile so you can see the difference the whitening process makes to your smile, and you'll be able to take the photographs home to show your friends. The dentist will apply moisturising cream with sunblock to your lips at the start of the procedure. Cheek retractors will then be placed in your mouth. Protective gauze and masking gel are applied so that only your teeth are exposed to the whitening gel and whitening lamp. An LED light source is used to set the masking gel. A balancing agent is then applied to get the optimum conditions for whitening. The Zoom gel that actually whitens your teeth is then applied. Sit the patient up to nearly 90 degrees as this aligns the light directly on the teeth and lessens the exposure to the soft tissue. The light source that activates the gel is then put into place. There are 3 cycles of 15 minutes. 3 minutes before the end of each cycle, a bleep is heard to let you know that the cycle is almost complete. At the end of each cycle, the gel is cleaned off your teeth, the colour of your teeth is assessed, and a fresh application of gel is then applied. The whitening procedure itself takes 45 minutes. You'll be pleased to know that you'll be able to watch a film of your choice or TV during this time using the DVD glasses. After this, the gel is removed, a fluoride paste is applied, and then you get to see your dazzling new smile.
Everyone's teeth has a protective layer called the acquired pellicle. This surface layer contains the surface dental stains and is removed during a regular dental cleaning and during the whitening process. It takes up to 2 hours for the barrier to fully develop again. During this period, we ask that you avoid anything that would stain a white shirt, for example, tea, coffee, red wine, colas, for the rest of the day. Eat and drink anything that is not heavily coloured, for example, rice, chicken, pasta carbonara. The final colour will be visible the next day. If your teeth are not sensitive and you would like to go whiter, then you can start using your top-up trays for 1 hour that day for up to 1 week. Stop using them when you are satisfied with the colour or if your teeth are becoming sensitive. Your teeth will be sensitive to temperature changes for 24 hours. If uncomfortable, take whatever medicine you would normally use for a headache. You can also place sensitive toothpaste or relief gel in your custom-made trays and wear for up to 30 minutes. Whitening may cause inflammation of your gums, lips or cheek margins. This is due to inadvertent exposure of a small area of those tissues to the whitening gel or the ultraviolet light. The inflammation is usually temporary, which will subside in a few days. Placing vitamin E oil will help calm the area.
Impressions will be made of your upper and lower teeth. Custom-made whitening trays will be specifically made for your own mouth. You'll notice that the tray for your upper teeth is bigger than the lower one. Brush your teeth to make sure your mouth is clean, and try your whitening trays to check that they provide a comfortable fit. As part of the whitening kit, you'll be provided with peroxide whitening syringes. Remove the cap on the head of the whitening syringe by rotating 180 degrees anti-clockwise and discard the cap. Fix the applicator nozzle onto the syringe head and twist to secure tightly. Remove the plastic cap. Only a small amount of gel is applied to the front surface of each tooth in the whitening tray. Here's how the whitening tray should be loaded. Place the upper tray in your mouth. If you have overfilled the tray with gel, wipe away any excess with your finger. Repeat the process for the lower tray. We advise you wear both trays at the same time. Your dentist will choose which gel will get your teeth to their maximum whiteness. The choice will depend on whether you prefer to whiten whilst you're asleep or during the day. The other factor is how quick you want the results and if you suffer from sensitive teeth. The amount of time that you wear the trays depends on the percentage gel that you are using. Night White is generally worn overnight and uses carbamide peroxide as its active ingredient. It uses a 10% strength gel which could be worn overnight whilst you sleep, or a 16% gel which could be worn for 2 to 4 hours twice a day or overnight, whilst a 22% gel would be worn for 1 hour a day. Day White uses hydrogen peroxide as its active ingredient with a 7.5 or 9.5% concentration of gel. Day White can be worn for 30 minutes twice a day. Please do not eat or drink whilst these trays are in place. Take the trays out by putting a fingernail under the edge of the tray. Rinse your whitening trays under cold water to remove any residual gel. Rinse your mouth out. Place the trays back in the carry case. Please avoid any foods or drinks that would stain a white shirt for 2 hours, tea, coffee, red wine or smoking. The next time that you use the syringe, squeeze out 2 millimeters of gel from the nozzle. This is the gel that is inactive from the previous session. Each syringe should give you 4 to 6 trays. If you've applied the gel correctly, this should give you 2 to 3 days of treatment. Remember, to achieve your maximum whiteness, you need to wear the tray for an hour a day for 7 to 14 days, or until you're happy with the colour, or you experience uncomfortable sensitivity. Any unused gel can be placed in the fridge for up to 2 years. Depending on your lifestyle, for example your diet or if you're a smoker, to maintain your new whiter smile you'll need to wear the trays once every 2 to 3 months. The time needed to wear the trays will depend on the gel your dentist gave you. Regular top-ups will mean the trays only need to be worn for one application at a time. If you've not used the top-up trays for a while, or your teeth have re-stained, then we advise wearing them for 4 to 5 consecutive days until the full whiteness has been achieved. If you have not worn the trays for a while, rinse them in some mouthwash for 30 seconds to freshen them. Further gel can be purchased from your dentist. If you haven't used the trays before, please view Chapter 2 on the home whitening. Many breath management systems claim to deliver long-lasting fresh breath, but science tells us the only way to truly achieve all-day fresh breath is to address oral malodor at its source. BreatherX does just that. With BreatherX, it's easy as 1, 2, 3, a simple brush, scrape, rinse routing. Patients love its effectiveness and have made it the #1 dentist-dispensed breath care system. Now you can gently clean the surface of your tongue with the BreatherX Gentle Tongue Scraper at home. The simple and easy action of tongue deplaquing has been shown to significantly reduce oral malodor and should become a regular part of every hygiene routine. Use the BreatherX Gentle Tongue Scraper with the antibacterial tongue spray to ensure that you experience all-day fresh breath. BreatherX's antibacterial mouth rinse's powerful dual-action formula uses cetylpyridinium chloride to attack odour-causing bacteria at the source, and Zytex, BreatherX's secret weapon to neutralise any residual odour. Do not swallow the mouthwash, but the formula is sugar-free and alcohol-free and does not dry your mouth, which keeps odour-causing bacteria from returning.